With COVID cases ticking back up, we want to turn to a familiar face now in a new role. Dr. Ashish Jha, taking a break from serving as Dean of the Brown University School of Public Health. He's now the White House COVID-19 Response Coordinator. Dr. Jha, good morning. Good to see you.
Good morning, Savannah. Thanks for having me back.
So how concerned are you about this BA2 subvariant? Are we in the midst of another surge?
Yeah, it's a great question, Savannah. I am not overly concerned right now. Case numbers are rising. BA2, we were expecting this, right, because we saw this in Europe a few weeks ago. But the good news is we're coming off of still very low infection numbers. Hospitalizations right now are the lowest they have been in the entire pandemic. So we've got to watch this very carefully. Obviously, I never like to see infections rising. I think we got to be careful, but I don't think this is a moment where we have to be excessively concerned.
As you know, the mask mandate for public transportation, airplanes, airports, trains, and the like, that is set to expire next week. Do you still support that, or do you think that perhaps the mask mandate should be extended for public transportation in light of these rising cases?
Yeah, this is a really good question. This is a decision that the CDC director, Dr. Walensky, is going to make. I know the CDC is working on developing a scientific framework for how to answer that. We're going to see that framework come out, I think, in the next few days. And based on that, we're going to want to be guided by this decision. You know, throughout the entire pandemic, we've wanted to make decisions based on the evidence and science. And that is what I expect we'll do again this week.
Well, let me just ask you, Dr. Jha, does that mean that extending the mask mandate in public transportation is a live option? It's on the table?
Yeah, look, this is a CDC decision, and I think it is absolutely on the table. And Dr. Walensky is going to make her decision based on the framework that the CDC scientists create, and we'll make a decision collectively based on that.
What about schools? How do these schools determine whether or not to have kids get back in masks? I know in the Northeast, we're seeing the cases go up. We're seeing a lot of kids certainly suddenly turning up with COVID. Do mask mandates or mask advisories need to come back in schools?
Yeah, so, you know, CDC, and again, you know, CDC has created a framework that I actually really like, and I've been very supportive of it well before I came into this role, which basically looks at each community and assesses risk based on infections, based on hospitalizations, hospital capacity. And one of the points that the CDC made was that schools should not be treated differently than the rest of the community. And so if there are mask mandates in the rest of the community, schools should have them. If they're not, they shouldn't be. That's what we should be doing. So people can go to the CDC, look up where the community risk is, and that's how we should be deciding what's happening in schools as well.
Do you feel, Dr. Jha, that you have a good handle on the number of cases, because we've seen some of those public testing sites close? People do private testing, or they don't test at all, but it doesn't get reported. So there's a lot of experts who feel that the case numbers are actually severely undercounted right now.
Yeah, so we've had undercounting throughout the whole pandemic, right? And that has always been an issue. There is no question in my mind with the rise of home tests, which I'm incredibly supportive of, by the way, right? I think home tests are great. We're going to miss a lot of those. We have other indicators. We have community-based surveys that we're doing of infections. Obviously, we're looking at hospitalizations. Those are still at very, very low levels. So I do feel like we have a pretty good grip of the overall picture, but no doubt about it, obviously, we're not capturing every infection, especially with people doing more home tests.
And finally, the president has been in close quarters recently with people who have subsequently tested positive, most notably Nancy Pelosi. That was last Tuesday at the White House. She was there again the next day, Wednesday, and on Thursday, she announced she had tested positive for COVID. You look at those pictures, not a mask in sight. In hindsight, is that a mistake?
Yeah, so the White House has very tough COVID protocols, very tight protocols around the president, and rightly so, right? He is the president of the United States. Everybody needs to be tested before they see him. And, you know, those protocols have kept the White House reasonably safe. Now, I would not be surprised if we continue to see infections pop up here and there, but so far, I think the key issue is to follow those protocols, make sure that people are vaccinated, boosted around each other, making sure people are getting tested. If we continue doing that, I think it's a very good way to continue to protect people.
But just given the fact that the president is 79 years old and he's not just anybody, he's the president, does the risk calculus change? Should he be wearing a mask?
Yeah, look, I think the COVID protocol in the White House is pretty stringent. You know, the one time last time I saw the president, I had to get tested right away, right before I saw him. I think that's really critical. And I think the White House is going to continue to assess this and base this on data. But I think the protocols right now are really quite effective at protecting the president, protecting others around him.
All right, Dr. Ashish Jha in his new role as COVID czar at the White House. Thanks for your time. Appreciate it.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.